Every 3 seconds, someone develops dementia, yet few realize it may begin in your mouth. Could brushing your teeth actually protect your brain? In this video, we'll uncover the powerful and surprising connection between Alzheimer's and oral health, plus the silent dental danger that may be accelerating memory loss. Here's a quick challenge. When was your last dental cleaning? Drop your answer below, and let's see how oral health habits line up with brain health awareness. 1. The shocking mouth-brain link. What if your gums held the secret to your brain's future? Scientists have discovered that harmful oral bacteria don't just stay in the mouth. They've actually been found in the brains of people with Alzheimer's disease. It turns out that gum disease may not only trigger local inflammation, but also travel through the bloodstream, sparking chronic inflammation in the brain. That's no small risk. It's a slow-moving brain threat. Brushing your teeth twice a day isn't just for a wider smile. It could be your brain's first line of defense against cognitive decline. Healthy gums, sharper memory. 2. The forgotten villain, P. gingivalis. Deep in your gums, there's a bacterial villain few have heard of, Porphyromonas gingivalis. This nasty microbe is commonly found in cases of chronic periodontitis and, shockingly, in the brain tissue of Alzheimer's patients. It doesn't just settle in. It triggers the immune system to go haywire, releasing toxic enzymes that can break down neurons over time. One mouth bug, 2 devastating effects. Daily flossing, antibacterial mouthwash, and regular dental visits can help eliminate P. gingivalis before it quietly travels north to your brain. Kill the bacteria, protect your brain. 3. Inflammation, the common culprit. Behind almost every chronic disease lies a quiet fire. Inflammation. Alzheimer's is no exception, and your mouth may be stoking the flames. Research shows that gum disease increases systemic inflammation, which can cross into the brain and accelerate neuron damage. This isn't just coincidence, it's a biochemical chain reaction. Inflamed gums, inflamed brain. The solution: daily flossing, anti-inflammatory foods, and treating gum infections early. Reducing oral inflammation is one of the most underrated steps in protecting your cognitive health. Cool the gums, calm the brain. 4. Your mouth's early warnings. Bad breath, bleeding gums, or a receding gum line. Your body may be sending brain alerts. These common dental issues are early signs of gum disease, and often dismissed as cosmetic annoyances. But in truth, they may be the first signals of chronic inflammation that threatens your cognitive health years down the road. Minor mouth symptoms, major brain consequences. Don't ignore the warning signs. Book a dental checkup and treat these symptoms early. A healthy mouth isn't optional, it's neurological protection. 5. Brushing isn't enough. Think brushing twice a day has you covered? Not quite. While brushing removes surface debris, it doesn't reach between your teeth, where harmful bacteria thrive. Flossing, tongue cleaning, and mouthwash are the often overlooked steps that complete the oral defense system. Skipping them lets silent inflammation build and spread. Brushing alone is a half-done job. Complete your oral routine. Brush, floss, rinse, and don't forget your tongue. The full system supports not just your teeth, but your memory. Whole mouth care equals whole brain protection. 6. Dental health declines before memory does. Here's a disturbing pattern. Long before cognitive decline is diagnosed, dental habits start to slip. Studies show that people in the early stages of Alzheimer's often show signs of poor oral hygiene long before they notice memory lapses. This neglect can fuel bacteria, inflammation, and further brain damage. Oral neglect may be the brain's first cry for help. Pay attention to your hygiene habits and your loved ones. Changes in dental care might be more than forgetfulness. Your toothbrush could be the first alarm bell. 7. Alzheimer's and tooth loss. It's not just about looks. Losing teeth may impact your brain. Research has linked significant tooth loss to an increased risk of Alzheimer's disease. Why? Fewer teeth mean less chewing, which reduces brain stimulation. Plus, tooth loss often signals years of underlying gum disease and inflammation. Fewer teeth, faster decline. Protect your teeth as you age. Get cavities treated, replace missing teeth, and don't skip dental visits. Strong teeth support a stronger mind. 8. The silent spread of oral bacteria. You won't feel it, but your mouth may be leaking bacteria into your bloodstream. Oral pathogens like P. gingivalis can pass through tiny cuts in infected gums and travel throughout the body, reaching even the brain. Once there, they trigger neuroinflammation that speeds up neuron death. Bacteria migrate, so does damage. Prevent this silent invasion with thorough oral hygiene and prompt gum treatment. Your mouth may look fine, but under the surface, damage can begin quietly. Block the spread before it hits your brain. 9. Saliva tells a story. It's easy to overlook, but your saliva is a health indicator. As we age, medications, dehydration, and chronic conditions often reduce saliva flow. This leads to a dry mouth, which allows harmful bacteria to thrive, increasing the risk of gum disease and inflammation. But here's what's surprising. Saliva contains antimicrobial compounds that help regulate bacteria and even protect the brain. Dry mouth, rising risk. Drink more water, chew sugar-free gum, and avoid mouth-drying meds when possible. Boosting saliva supports both oral and cognitive health. Moist mouth, sharper mind. If that surprised you, imagine how many others have no idea. Hit the like button if you've learned something new so far, and if you know someone over 50, share this video with them now. You might be helping protect their memory without even realizing it. Let's get this life-saving info to more people. 10. Cognitive load and oral hygiene. As memory fades, even basic routines slip away, including brushing and flossing. People in early dementia stages often forget oral care, leading to a dangerous cycle: declining hygiene, more gum disease, and faster cognitive decline. But here's the twist. This cycle can be slowed with caregiver support and consistent routines. When memory weakens, the mouth suffers. If you're caring for someone with Alzheimer's, add dental care to the checklist. Small daily reminders can have lasting brain benefits. Support the mouth, stabilize the mind. 11. The cost of avoiding the dentist. Dental anxiety is real, but ignoring it can cost you your memory. Many older adults skip dental visits for years, allowing gum disease to worsen silently. By the time pain or tooth loss sets in, the damage may already be systemic, fueling inflammation that reaches the brain. Late care, lasting consequences. Routine cleanings every 6 months aren't just about oral health. They're early intervention for cognitive protection. Facing the dentist now may save more than your smile. Prevention is brain power. 12. Nutrition, mouth, and mind. Ever try eating leafy greens or nuts with a toothache? Oral pain reduces your ability to chew healthy, fiber-rich, brain-supporting foods, causing a shift towards softer, often less nutritious choices. The result? Declines in B vitamins, antioxidants, and omega-3s, all essential for brain health. Painful mouth, poor nutrition, poorer cognition. Fix dental issues early to preserve your ability to eat well. Your mind depends on what your mouth can handle. Chew well, think better. 13. Alzheimer's medications and oral side effects. Sometimes the cure brings new complications. Many Alzheimer's medications list dry mouth as a side effect. This decreases saliva production, which leads to faster bacterial buildup, gum disease, and mouth discomfort, fueling even more inflammation and potentially worsening cognition. Relief for one symptom, risk for another. If you or a loved one are on memory medications, talk to your doctor or dentist about counteracting dry mouth. Simple steps like hydration, oral gels, or switching medications can help. Balance brain meds with mouth care. 14. The role of oral microbiome. Your mouth isn't just a gateway, it's a microscopic universe. Billions of bacteria live there, forming the oral microbiome. When balanced, this system protects your health, but when harmful bacteria take over, often due to sugar, smoking, or poor hygiene, it can trigger inflammation that reaches the brain. Imbalanced mouth, imbalanced mind. Improve your oral microbiome with better brushing, probiotics, and cutting back on sugar. The harmony in your mouth may reflect the health of your brain. Feed the good bugs. Protect your thoughts. 15. Dental cleanings as brain checkpoints. Your dentist might notice mental decline before you do. Many people in the early stages of dementia begin neglecting their oral care, showing up to cleanings with more plaque, missed appointments, or behavior changes. Dentists are often the first professionals to detect these subtle signs. Oral health is a mirror of mental health. Regular dental visits don't just keep your mouth healthy, they help monitor early cognitive changes. Let your dentist be part of your brain defense team. 16. Fluoride and brain health. The controversy. Is fluoride a friend or foe to your brain? Some claim that fluoride in water may harm the brain, but current research shows no conclusive link to Alzheimer's. In fact, fluoride strengthens enamel and reduces cavities, an essential part of preventing gum disease. Fear lacks proof, but science supports balance. Use fluoride toothpaste unless advised otherwise by your dentist, and focus on reducing sugar and acidic foods instead. Protect your teeth with facts, not fear. 17. Elder care and dental neglect. In care homes, mouths are often forgotten. Many seniors in assisted living or memory care don't receive regular oral hygiene due to undertrained staff, lack of prioritization, or the patient's own resistance. The result? Rampant gum infections that can quietly fuel brain inflammation and accelerate decline. Neglect at the gums, damage in the brain. If you're advocating for a loved one in elder care, ensure daily oral care is part of their routine. A few extra minutes a day can make a world of difference. Advocate for mouths. Defend their minds. 18. Building a mouth-brain routine. The good news? You already own the tools. To protect your brain, follow this simple daily routine. Brush twice with fluoride toothpaste. Floss once. Use alcohol-free mouthwash. Stay hydrated. See a dentist every 6 months. Add in a low-sugar, anti-inflammatory diet, and you've built a brain defense system starting in your bathroom. Mouth habits, mental health. Small, consistent steps now can help delay or even prevent serious cognitive decline later. Your brain starts with your brush. Your mouth and your memory are more connected than we ever imagined. The science is clear. Bacteria, inflammation, and poor dental habits don't just stay local, they echo throughout your body all the way to your brain. But with just a few small daily actions, you can take control. Want more brain-protecting habits? Don't miss our next video on everyday foods that silently strengthen your mind. This content is for informational purposes only and does not constitute medical or dental advice. Always consult a qualified healthcare provider or dental professional for guidance specific to your needs.